I go on to introduce the second speaker. Dr. Wayne Ramkrishna is Deputy Director at the National Department of Health of Communicable Disease Control. Welcome, Mr. Ramkrishna. I promoted you to doctor. Thank you very much, and we are looking forward to your presentation.
Thank you very much, Madam Chair, and thank you very much, colleagues. I'm going to talk briefly about some of the frequently used policies when dealing with epidemics in South Africa. Next slide, please. So the next slide is on the presentation outline. And I've highlighted like 6 points that I would like to focus on for this presentation. The first one being coordination at national, provincial, and local levels. Secondly, we shall highlight some key points in the National Health Act and the Notifiable Medical Conditions Regulations. Thirdly, we'll talk about policy at global level, specifically on the National Health Regulations. And at the regional level, we'll talk about the SADC Protocol on Health, and also maybe just touch upon the African Union and the Africa CDC. Number 4, we'll talk about integration and collaboration. Number 5, we'll talk about policy decisions to strengthen service delivery. And here I will use the development and implementation of the influenza policy and strategic plan as an example. And number 6, we'll highlight key points as a summary and way forward. So our world is changing as never before, as we're experiencing at the moment. We have populations growing, the age and the move, diseases travel fast, microbes adapt, and as chemical radiation and food risk increase, health security is at stake. Next slide, please. The COVID-19 pandemic demonstrates the importance of prevention, preparedness, and response measures for the control of communicable diseases. Control is a vital function of the protection and promotion of public health and requires an enabling legislative framework for its implementation. In South Africa, the overarching coordination body for outbreak response is the Multi-Sectoral National Outbreak Response Team, abbreviated as the MNOT. The MNOT is led by the National Department of Health with support from the NICD, the WHO, the US CDC, and other partners. As part of coordination, there are several other departments involved, such as Department of Agriculture, Land Reform and Rural Development, Department of Home Affairs, the Department of International Relations and Cooperation, and the Department of Transport. Coordination structures at national level are cascaded to the provincial level through the multi-sectoral, multidisciplinary provincial outbreak response teams, which are in turn cascaded to lower levels, that is to districts and sub-district levels. In terms of the current COVID-19 response, multiple sectors and partners are engaged in COVID-19 preparedness and response framework for South Africa and led by the National Department of Health. Other government departments involved include corporate government and traditional affairs, Department of Safety and Security, the Joint Operations Center, and the National Disaster Management Center. Key non-governmental partners include WHO, the Clinton Health Access Initiative, the US CDC, the Red Cross, and several other private sector partners. Go to the next slide, please. So in terms of the National Health Act and the NMC regulations, the Health Act and the regulations relating to the surveillance and control of notifiable medical conditions, also known as and referred to as the NMC regulations. These documents can be easily downloaded from the internet. And we'll briefly touch on how these pieces of legislation influence epidemic preparedness and response in South Africa. In terms of the National Health Act, the Minister of Health has a responsibility to, within the limits of available resources, determine the policies and measures necessary to protect, promote, and maintain the health of the population. And this is found in section 31C of the National Health Act. Under section 21(1)(a), the Director General of Health has a responsibility to ensure the implementation of national health policy insofar as it relates to the national department. Under section 21(1)(b), the Director General of Health has a responsibility to issue guidelines for the implementation of national health policy. Under section 21(2)(b), the Director General of Health has a responsibility to issue and promote adherence to norms and standards on health matters, and this includes nutritional interventions and environmental conditions that constitute health hazards. Under section 21(2), so can we go to the next slide, please? Oh, my apologies. Under section 21(2)(k), the Director General of Health has a responsibility to facilitate and promote the provision of health services to the management, prevention, and control of communicable and non-communicable diseases. And under section 23(a)(9), the National Health Council advised the Minister on epidemiological surveillance and monitoring of national and provincial trends with regard to major diseases and health risks for diseases. Now, provincial and district health councils also have similar functions on communicable disease coordinators. And these pieces of legislation, referring to section 23(a)(9), requires provinces and health districts to compile strategic and annual performance plans, which should be made up of components that include disaster plans as well. So from a national level right down to the lowest level, the National Health Act gives responsibilities to the various levels to have systems in place for reporting and response and being prepared to handle outbreaks and epidemics. Thank you. Next slide, please. Yeah, we'll talk briefly about the rights of individuals versus the public. And this is stipulated in the National Health Act and the regulations. A person's right to autonomy occasionally comes into conflict with the rights of the larger society. The most common circumstances is when an individual refuses to be examined or treated for a dangerous communicable disease. The NMC regulations published under the National Health Act makes provision for mandatory medical examination, isolation and quarantine of carriers, contacts, and sufferers of specified communicable diseases. This issue is also addressed by stating that health should not be provided to users without their informed consent, unless failure to treat the user or group of people, which includes the user, will result in a serious risk to public health. The regulations do not go so far as to make treatment mandatory, but an infected person who willfully refuses treatment may be put into quarantine by order of the High Court. Similarly, the High Court may order carriers or susceptible contacts to be quarantined if they pose a risk or threat to public health. The regulations also make it mandatory for carriers, contacts, and infected individuals to comply with instructions from healthcare providers regarding precautionary measures to prevent or restrict the spread of infection. We'll go to the next slide, please. Another important area in the control of communicable diseases is the notifiable medical conditions, or the NMC notification system. Based on the National Health Act, Act 61 of 2003, it states that specific infectious disease must be reported on specific government forms on a daily or weekly basis to the local authority or the local municipality, and then to the next level for action. I stress the word action. Okay. Any healthcare worker who sees and diagnoses a case or death from a notifiable medical condition, in both, it applies to the public and private sectors as well, they have the legal responsibility to notify such a case or death immediately to the relevant the local authority. Notification will assist health authorities to speedily implement measures that will prevent spread of the disease and the unnecessary loss of human life. The notification system is based on clinical notifications. Therefore, all suspected cases must be immediately notified even before lab confirmation is received. Now, this is important because in many instances, lab confirmation only comes in maybe 2 or 3 days later, and the health authorities cannot wait that long before implementation measures can be put in place to prevent further cases and deaths. The local authority shall investigate and do all it can to control any disease that is notifiable or communicable. Should extra resources or expertise be required, the provincial and national departments of health will be available to assist. Next slide, please. I'm just going to talk about a brief touch on the National Public Health Institution of South Africa, or the NAPHISA bill. The NAPHISA bill was developed for, amongst others, establishment of a single national public entity to provide public health services to the country that performs critical public health functions and that requires a high level of coordination across functions, such as surveillance and research, in order to provide support, expertise, and advice to government, to provide coordinated disease and injury surveillance, research, training, and workforce development, monitoring and evaluation of services, and interventions directed towards the major health problems. And they also to provide training, conduct research, and support interventions aimed at reducing the burden of communicable and non-communicable diseases and injuries, and aimed at improving occupational health and environmental health. So once the NAPHISA bill has been passed, we'll see a greater level of coordination across the sectors, but also beyond the traditional outbreak response measures related to communicable diseases. So they'll also move towards areas such as the non-communicable diseases, deaths due to injuries, and as well as occupational health and environmental health as well. Next slide, please. So at the global level, we have the international health regulations. And at the regional level, we have the protocol on health. And we should also touch on the African Union and the Africa CDC. The International Health Regulations 2005, or the IHR 2005, represents a binding international legal agreement involving 196 countries across the globe, including all the member states of the WHO. The aim is to help the international community to prevent and respond to acute public health risks that have the potential to cross borders and threaten people worldwide. The purpose and scope of the IHR is to prevent, protect against, control, and provide a public health response to the international spread of diseases in ways that are commensurate with the restricted public health risks and which avoid unnecessary interference with international traffic and trade. Now, South Africa, being a member state of the WHO, has obligations under the IHR 2005, and therefore we need to have systems in place as stipulated in the international health regulations. Now, next slide, please. Now, this is a very important piece of international legislation that I will spend a little bit more time on. So what does the IHR call for? It calls for strengthened national capacity for surveillance and control, including in travel and transport. It calls for prevention, alert, and response to international public health emergencies. It calls for global partnership and international collaboration, and calls for rights, obligations, and procedures, and progress monitoring. So these are some of the obligations that are placed on WHO member states, including South Africa. Next slide, please. So why must countries implement the IHR? What is in it there for us as a country? The purpose is to detect and contain public health threats faster, to contribute to global public health security, and to enjoy the benefits of being a respected partner. In return, countries receive WHO assistance in building core capacities. They receive WHO's guidance during outbreak investigation, risk assessment and response. They receive WHO's advice and logistical support, and they receive information gathered by WHO about public health risks worldwide. So it supports our surveillance internationally. And we get assistance to mobilize resources. Next slide, please. We often hear the term fake or the public health event of international concern. We've been hearing it quite frequently since the COVID-19 pandemic. So a fake is defined in the IHR as an extraordinary event which is determined to constitute a public health risk to other states through the international spread of disease and to potentially require a coordinated international response. This definition implies a situation that is serious, sudden, unusual, or unexpected. It carries implications for public health beyond the affected states, national border, and may require immediate international action. Now, the COVID-19 was declared a public health event of national concern on the 30th of June, 2020, following the International Health Regulations meeting and advice from the WHO Expert Committee. Next slide, please. Now come to the regional level and some of the coordination mechanisms and policies that are in place. The first one being the SADC Protocol on Health. With a high level of poverty in Southern Africa, communicable diseases are a serious concern for social and human development in the region. The SADC region accounts for 1/3 of all people living with HIV and AIDS worldwide. It accounts for 8 SADC member states among those countries with the highest rates of TB, and 75% of SADC population is at risk of contracting malaria. So this trio of disease is a major threat to sustainable development in the region. And as a result, a number of protocols, declarations, plans, and programs have been developed to combat communicable disease, including the following: Declaration on HIV and AIDS, the draft declaration on tuberculosis in the mining sector, SADC HIV and AIDS strategic plan, SADC strategic framework for control of tuberculosis in the SADC region, the SADC malaria strategic framework, and the SADC malaria elimination framework. Next slide, please. Regional annual reports on HIV and AIDS, TB, and malaria all contribute to systems designed to monitor progress on combating these communicable diseases. Overseeing all of these declarations and strategic frameworks is a protocol on health, which was established in 1999. Article 9 of the protocol on health addresses communicable disease control, while Article 10, 11, and 12 specifically concern HIV and AIDS, malaria, and TB. The protocol on health advocates that member states harmonize their policies for disease definition, notification, and management. And member states agree to cooperate in establishing reference laboratories and sharing information on diseases and epidemics, insofar as this information contributes to the reduction, elimination, and eradication of communicable diseases. So, colleagues, you can see that there's a vast amount of policies and declarations and agreements that are out there, and organizations have also put in place mechanisms to coordinate the various stakeholders and to monitor and coordinate the implementation of the various activities stipulated in these policies. And it's very important that as we implement several policies at the same time, we do not have conflict among the implementation teams, or the agendas are not compromised as well. So next slide, please. So here we highlight key roles of the Africa CDC and the Africa Union. The Africa CDC, in collaboration with Africa Union, support preparedness and response, and in particular to the COVID-19 support. These include assessing country readiness using the WHO COVID-19 checklist, developing preparedness and response plans, laboratory diagnostic support. They provided rapid response teams that supported member states on the region, and they supported with conducting simulation exercise regionally, as well as supported countries as well. And by providing a coordination mechanism with other countries and bodies, such as the WHO AFRO, WHO MRO, the Nigeria CDC, and so on. These organizations, that is the African Union and the Africa CDC, collaborate with other organizations as well, such as the NICD South Africa, where the NICD supported with conducting sub-regional training for member states. We'll go to next slide, please. So in terms of integration and collaboration, we'll talk about zoonotic disease, which is a major threat in recent years, especially considering the avian influenza outbreaks, and most recently the COVID-19 pandemic as well. And we also talk about a response using the One Health approach. So as a background, the World Bank report of 2018 highlighted the burden of zoonotic diseases as accounting for more than 1 billion cases and 1 million deaths annually. In addition, the economic costs of emerging and pandemic diseases are considerable. In Africa and around the world, endemic diseases contribute to persistent disease and economic burden through impacts on health and livelihoods, as well as agricultural production and ecosystems. The occurrence and impact of known and novel disease outbreaks are likely to increase with changes in land use, agricultural practices, climate and weather, travel and trade, and urbanization. Zoonosis and other health threats at the human-animal ecosystem interface pose ongoing and increasing risk to public health. African countries seem to be faced with a disproportionate level of these risks. Health threats at this interface include those existing and emerging pathogens transmitted through contact with animals, food, water, and contaminated environments. And examples would include avian influenza, bovine TB, brucellosis, Middle East respiratory syndrome, coronavirus, rabies, Rift Valley fever, antimicrobial resistance, and most recently as well, COVID-19. So these are some of the diseases that are prevailing within the country, and we are facing challenges with them as well, either through responding to cases and outbreaks, or through preparing for inadvertent cases arriving on offshore, such as the Middle East respiratory syndrome coronavirus. Next slide, please. In addition, a WHO review committee following the 2009 pandemic concluded that the world is ill prepared to respond to a severe influenza pandemic or to any similar public health emergency. Therefore, WHO launched the Joint External Evaluation, also known as the JEE, in 2016, for countries to systematically evaluate the preparedness and response capacities and to address the gaps. Majority of countries in Africa have completed the JEE and are in the process of drafting national action plans. WHO member states have obligations in terms of the IHR for having systems in place for identifying and assessing potential public health threats, including zoonosis. However, as Dr. McCarthy mentioned earlier, these threats cannot be addressed by one sector alone. This brings us to the One Health approach. Now, the complexity of interaction along the interface requires strong and consistent collaboration among the sectors responsible for human health, animal health, and the environment. This is referred to as the One Health approach. So what has the Department of Health been doing in terms of the One Health approach? Recognizing this fact, the Department of Health in South Africa facilitated the establishment of the One Health Forum in 2015, which includes members from the NICD, Department of Agriculture, Department of Environmental Affairs, the universities, and all provinces. The goal of the One Health Forum is to strengthen collaboration and coordination between public health, animal health, and the environmental sectors for prevention and control of zoonotic diseases, as well as to meet the IHR obligations. In addition, a steering committee was established comprising of key members from the One Health Forum and serves to guide the activities of the One Health Forum. The steering committee and the One Health Forum are co-chaired by the NICD and the Honest Report Veterinary Institute. South Africa is in the process of drafting a One Health framework, and when it is being completed and approved, it will guide the activities of the stakeholders involved in One Health. This will entail not only shared responsibility, but shared benefits as well. Next slide, please. So now we shall talk about policy decisions to strengthen service delivery using the development and implementation of the National Influenza Policy and Strategic Plan as an example. In South Africa, influenza causes approximately 10,000 deaths and 40,000 hospitalizations annually. The highest rate of hospitalizations and deaths is seen in the over 65-year-olds, the HIV-infected individuals, and children under 5 years. Pregnant women represent an important risk group for influenza-associated mortality. Among women of childbearing age, majority of the estimated seasonal influenza-associated deaths occurred in HIV-infected individuals. Studies suggest that patients with TB may have an increased risk of influenza-associated deaths, and hospitalized patients co-infected with TB are 5 times more likely to die than those without TB. So colleagues, this information was derived from major literature reviews, as well as a number of research programs that were undertaken internationally and very importantly within the country as well. So we have generated this information, and once we have established or we have understood the problem, in response, the Department of Health developed a National Influenza Policy and Strategic Plan, which promotes annual vaccinations against influenza, which is the best strategy for preventing disease and severe complications. However, other measures such as health education, basic hygiene, cough etiquette, social distancing when ill, and infection prevention and control are important preventive measures that are also emphasized. So colleagues, when developing and implementing policy, it has to be doable, or it has to be implementable. And in that sense, implementing or delivering influenza vaccines alone is not possible. It is a very expensive process for the country. So it's not, it cannot be implemented for everyone. So the high-risk groups were provided with the vaccines, but other people who are not eligible for government-funded vaccines, we still need to implement the non-hospital interventions, such as those that I've mentioned, basic hygiene, cough etiquette, and so on. So development and implementation of the policy requires an integrated approach involving several clusters and expert groups. And these include clusters such as the non-communicable disease cluster in the National Department of Health, as well as directorates such as chronic diseases, geriatrics, HIV, TB, mother and child health, and expert groups such as the NIC, WHO, the USCD, and so on. We go to next slide, please. So, as summary and way forward, the legislative mandate of the Department of Health is derived from the Constitution, the National Health Act, and several pieces of legislation passed by Parliament and guided by sections 9, 12, and 27 of the Constitution. They are also guided by the National Development Plan 2030, the 2030 Sustainable Development Goals, and in particular, Target 3.3, which states that 2030 end epidemics of AIDS, TB, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. We're also guided by and also held responsible by the international health regulations, the World Health Assembly resolutions on communicable diseases, as well as WHO strategies and guidelines. Now, these legislations lead to national and subnational policies, guidelines, plans, SOPs, and so on. Thank you. Next slide, please. So as a way forward and conclusion, we need to strengthen health systems to be resilient and prepared to face existing and future disease threats. The various sectors such as public health, animal health, plant and environmental health, and researchers need to join forces to support the One Health approach to effectively detect, respond to, and prevent public health events, including outbreaks of zoonosis and foodborne diseases, and to combat antimicrobial resistance. We need to encourage collaboration and sharing of resources, epidemiological data, and laboratory information across sectors and national boundaries. WHO and FAO and the OIE are commended in their efforts to promote multi-sectoral response to food safety hazards, risk from zoonosis, and other public health threats at the human-animal ecosystem interface. However, much needed support and guidance on how to reduce these risks are required. We need to conduct regular monitoring and evaluation of policy implementation activities, and this includes risk assessments. And we need to strengthen the One Health approach nationally, regionally, and globally. Thank you.